Hi everyone. So today actually our guest is Mr. Rizwan Qureshi, and he's actually an international medical graduate from Pakistan who actually initially migrated UK after PLAB and then after MRCS and 3 years of training moved tr and trained in Australia. And now he's actually working as a consultant in the emergency medicine Sydney. He's actually also a founder and director actually of Emergency Focus, which focuses on courses related to international medical graduates. So hi Rizwan, how are you?
I'm good, Omer. It's finally good to see you in person,
Same
albeit
here.
over the camera, but the pleasure's all mine. How are you?
Yeah, I'm good. I'm good. We have definitely had our discussions over the phones a lot. It was actually a quite great conversation, I would say. A lot of brainstorming, and then finally we are seeing each other today.
Always a pleasure.
So I hope life is treating you well.
Yeah, life's been pretty busy, pretty hectic ever since the COVID is easing off. The hospital's getting more busy. The emergency departments are just flooded with patients. Also,
Uh,
the GP practice patients are unable to get appointments with the GP. So yeah, it's busyness all around. Plus, as you know, that I run a little side business with emergency focus. So we've been busy running courses for IMGs as well. So it's busyness all around. This day in particular, I'm working 7 days a week. So
wow,
very busy time.
7 days a week. Wow. Yeah, I think I've always seen ER doctors are always working, day and night, and mostly it's basically of the work style is like that. Is that for every doctor?
My clinical work is only part time. I work 3.5 days a week,
Okay.
and being an emergency specialist, I don't carry any work home. It's my non-clinical work which I have got more involvement in, and that's through emergency focus. So, because we're running courses, most of the work is now delegated through the tutors, but I'm also teaching on one of the main 6 week course. So that takes up a lot of time. We've got 3 sessions in now, and all those 3 sessions are on my off days. Then we've got inquiries, we've got requests, we got new courses coming up, so registration and particulars about that. So that sort of keep me on my toes.
Wow. That's
But other specialties might be way too much busy than me, Umair. So the GPs are working sort of 9 to 5, 8 to 4 kind of thing, and the hospital doctors are just busy all along. It's
wow.
just a matter of work now.
Well,
Plenty of work.
at the moment, GPs are struggling with the rebate. I hope that's not the case with you guys as well.
No, it is actually the case with us as well. So basically, I'll give
Okay.
you a little bit of background. When I did my fellowship in emergency medicine here in Australia, that was in 2015, and the circumstances were quite different. At that point, I was able to get a consultant job in the city. At the same point, when I was working as a consultant, I saw that there were lots of registrars and junior doctors who used to come from the UK. Fast forward a few years later, in fact, 5 years later, when the pandemic hit,
Yeah.
all of that medical migration stopped, came to an absolute stop, halt. And none of the doctors were able to come from the UK. And the doctors who were working here started to get sick. So they were going into quarantine periods. They were also having burnout because they're meant to be taking some extra work because their colleagues are getting off sick. So
Wow.
what it left us with was a relative deficiency, which is still the case. We've got a relative deficiency of doctors in emergency department, in ICUs, in medical specialties. In fact, on my given day, I even so as I was telling you, Mayor, that I was talking to one of the medical specialists, and they are just head over heels with the number of patients that they've got admitted under their care. They're saying they've got 60 to 80 patients, and they've only got like 4 doctors looking after all those patients. So it's very challenging, obviously. And I think it's just a post-pandemic issues that we're just coming to terms with, that how to deal with that. So that leaves us. I believe that look, every challenge gives us an opportunity, and right now, I think there's a tremendous opportunities for doctors to come in and join the medical workforce. The hospital have increased their medical staffing level, the nursing staffing level, and all the ancillary staff. So I think it's looking good both ways. Even though these are challenging times, but I think we are moving ahead with these issues in a very positive way.
That's great. And I believe because of there were a lot of the doctors were also during COVID, there were a lot of doctors not available because they also got infected from the virus, and that's why they were not available. And that must have
Yeah, so
definitely.
that's Yeah, so that's the issue both with the doctors, nurses, and also the other hospital staff. So, as per the Australian and Commonwealth quarantine requirements, you still have to isolate for 6 days if you tested positive. So, imagine if you're a doctor working on a roster and you've got 5 days to work or 4 days to work, and you're off work for 6 days because of sickness, then this leaves a huge roster gap of multiple shifts, both for the junior and senior doctor. So yeah, it is very challenging as we speak.
Oh. So basically, is IMG your solution to that?
Well, I think in a short term, yes. And, we have seen times and times again that whenever there's an opportunity, you are able to enter into the system. And through that opportunity, you're able to build up on that credentials. You get into the job, you start doing your training, you start doing your exams, and then you never look back. And every now and then there's a system which allows these kind of entrance points. Right now it's pandemic. Before that it was some exhaustion and burnout from the doctors, or there might be some other situations as in. And we've seen that I think Australia tends to follow the model of the UK. In the UK, I believe when I was in 2005, there was a huge chaos. There were no doctor jobs for IMGs. And in fact, that was one of the reasons that I left UK, because the doctor job, especially in the training position, were very difficult to find. So I moved over to Australia. But that sort of concentration of doctors diffused afterwards. Some doctors moved overseas, some doctors moved back home to Pakistan or India or to other countries that they came from, and that created more opportunities for the IMGs to gain into that UK system. Similarly, what's happening here, Umair, is that due to COVID, there have been challenging circumstances. Doctors and the other junior medical doctors and consultants getting off sick. Some doctor burnout. They've reduced their fraction of work. So they might have been working full time, but now they're working part time. And that has created again an opportunity. Only the difference between this opportunity and that opportunity, this is a huge opportunity. Right now, the hospitals are completely redefining the way that they look after patients. So they're using everything in their scope of practice to recruit more doctors. So the hospitals are also going under expansions. The staffing levels are improving. The patients, obviously, Australian population, as you know, is an aging population. So there's always going to be a huge demand of the system. And the answer for that is to improve the resources, especially the staffing resources. You may have recently heard about Royal Commission looking into the aged care sector.
True.
And there's some critical deficiencies in aged care sectors, not only from the primary healthcare and the hospital care point of view, but also in the residential aged care sector. There are hardly any staff, and the government is now taking some concerted steps to improve the level of staffing. In fact, there have been even, the pay incentives, that the pay of the staff working in aged care sector is to increase by 25%. So these are all very positive steps and much needed ones as well to meet up the increase in growth and demand of the health sector, especially in the areas where they're most needed.
I guess this is definitely a debate on other industries as well, which is going on, shortage of staff. And especially like I was in actually a Hill Chamber event, and we were actually going through some SAPE stats. They over there also they mentioned that what actually happened when COVID hit, a lot of businesses were affected. A lot of people switched their careers to different careers and they never came back to the original one. But I think with medical industry that was not the case. With you guys, that was not the issue. But I think the global availability of resources was most of the challenge which was there, and especially when there was no migration happening for the past during the whole COVID, there was not even a single migrant coming to Australia. That must have created a lot of backlog.
That is huge. Talking about backlog, we've heard about the elective surgical lists, the times to have a hip replacement, the times to have knee replacements, some of the elective procedures, they've been pending. And there's also, this is the tip of the iceberg. Some of the patients have been lost to follow-up that we are now currently seeing some of the issues rising up and presenting to, their GPs and hospitals in emergency department. And you know what type of patients they are? They're the patients with cancer who were lost to follow-up and they were unable to book in to see their specialist.
Really?
And they're now presenting with a severe manifestation of spread out disease. And I've seen them countless times. I cannot believe, like, before that, it was a rarity to see a patient presenting for the first time with a cancer. Now, in the last 1 week, Umair, I've come across at least 4 or 5 patients, at least one patient every day who's presenting with the manifestation of metastatic cancer. That's just mind-boggling to see these kind of problems, and I wish that this system can be rectified, these issues can be rectified by better planning and resource dispersion.
No, and definitely I hope for the best. That was really an eye-opening thing for us as well. Like going to that extent that even the urgent patients who require urgent support were not able to get that. Yeah.
Absolutely.
Okay, so basically, this one, I'm gonna go a little bit off, like on to your experience as well. I just wanted to see, so as an immigrant doctor, what difficulties you faced when you came to
So
Australia?
yeah, so look, I have been fortunate enough to offset some of the challenges that a typical international medical graduate coming from a third world country faces in Australia. Now, the reason I said that I've been able to offset is because of very good reason. I was initially working in the UK. I was there for about 3 years. I had a good exposure to a first world country medical health system. So I knew the ins and out of that system. So transitioning from the National Health Service working or ethics of working in National Health Service coming to Australia, it was a seamless integration. The system over here works almost similarly to the UK. The only difference is that Australian health system is relatively less busy compared to the UK. However, even with that kind of training and backup, I was able to sense some issues, some thorny issues, which had to be smoothened out. Look, if I was to divide the issues, I would probably divide them in between professional and personal issues that every IMG will face. Now, professionally, that working with the IMGs that I have been talking to them, I've been engaged with them with their professional needs, their credential development, and plus their future plans as well. One of the main differences the IMGs are facing here is not being able to get the jobs. All right, and that is not new. In fact, some of the problem which comes for the junior doctors not being able to get the job is because of their huge career gaps. They've worked in a third world country. Most of the doctors who are migrant doctor here in Australia in particular are the female doctors who've been married to engineers and other partners who are working in other non-health sectors, or even doctors for that matter. But they've primarily been homemaker, and that's completely understandable. In our part of social fabric and social setup, the women tend to take an in charge and a lead role to look after the household matters. So these doctors who become doctors back home in Pakistan or whichever country they've come from, India, Bangladesh, kind of very similar social setup. And as a result of that, they've got huge career gaps. In fact, that is a part of every household. Even my wife, when we moved here from the UK, she was looking after my daughter when I was training initially. So she was home. But then we realized sooner that, look, we cannot leave the career gaps so long, and we need to, get her back to the medical workforce. So that is a personal background of most of these doctors. They've got career gaps, and plus they've worked in a system which is not in parallel line with an Australian health system. And
True.
I think the key things to realize here, Umair, is that they need to prove their worth professionally before being given a chance for being accepted back into the medical workforce. When I say proving their worth, they now have to invest at least 12 to 18 months in a process of reaccreditation. So that means they have to sit the equivalence exams first and the
Mm.
foremost. That is AMC Part 1 and AMC Part 2.
True.
They then have to do some courses, which is a reassurance to the employers that they're safe doctor. They can, they're accredited from the life support measures like advanced cardiac life support, trauma life support, pediatric life support, plus procedural skill courses and communication skills courses. All of these courses really help and build up the confidence of the employers that this is a doctor who's been actively involved in improving themselves. They're just not sitting idle. So that's the other aspect. And the third aspect, which is we as IMGs are completely naive about that. Once we tend to do the exam and courses, we think the job will land in our lap. It's not like that, man.
Mm.
Applying for jobs is a completely different ballgame. And applying for a job is, in fact, a job in itself.
True.
I have come across IMGs who apply for at least 10 to 12 jobs every week. So 2 to 3 jobs on an average per day. And job application is not easy. It's not just a matter of dropping your CVs or application forms. It's actually targeting the questions relevant to the job description and essential and desirable criteria to pluck out the information from your CV, targeting that specific questions. So it takes a lot of time and effort, and especially if you've got young family or other domestic responsibilities, it is not easy. So these what I tend to say a chaotic mix of both professional and personal challenges. But then again, if you organize yourself, if you come into the rhythm of doing things regularly, these things do tend to ease out. And fortunately enough, with the pandemic, we're seeing lots of doctors who've really invested in themselves in the last 6 to 8 months. They've been getting jobs, and in fact, most of the doctors who've come to our courses, I'm very lucky and very fortunate to say that most of them have managed to get themselves a first job. Some of them have had, Umair, a career gap of 8 years, 10 years.
Wow.
But they just sat down and they said, okay, this is it. Next 6 to 8 months, I'm going to completely invest in my professional development, and let's see where it takes us.
So basically, after doing that course, do you guys also help them to land a job as well, or is it just the courses you offer?
So, medical job is like an apprenticeship. So you learn at the job. So you can prepare yourself as much as possible. The job is both about communication, about your skills, about your procedural skills, about your ability to manage common illnesses. Plus, on top of that, there are certain things you can only learn at the job by, having a broad exposure towards a wide variety of disease. So
Mm.
when the IMGs come to me and work with me in the hospitals, I work in Wollongong and Liverpool Hospital. My advice to most of the IMGs is see everything and anything. If it's complicated, it's yours. If it's simple, it's yours. I'm here to, hone your skills in terms of talking, communication skills, procedure skills, whatever it takes to manage that patient safely. Because you see, Australian system is good from that point of view. They're not going to give everyone and anyone a job. First of all, they're going to make sure that you're safe. Then the IMGs get assigned as level 1 or level 2 supervision, meaning depending on their previous experience, level 1 is more basic and level 2 is more advanced. Are we okay?
Yeah, yeah.
Because it seems to have decided. Okay. So, most of the IMGs are in level 1 supervision. They get more closely supervised by the consultant. So that's where our role comes in to guide these IMGs on the floor to make sure that they're well exposed to the broad variety of diseases and how to manage these diseases individually. Not only that, how they're communicating with the patient, plus how they're progressing on with their term meaning how they're progressing on with a particular specialty, emergency medicine, geriatrics, respiratory, whatever term that they're doing, and take it from there, because all of these terms at the end of the year will make their reference, which is pivotal and absolutely essential issue for getting the next job. So, you can learn as much skills as you like. You can get your first job, which is the big part of the hurdle. But then on job training and improvement is key to your seamless transition into wherever you want to be. Maybe you want to become a cardiologist, a gastroenterologist, or surgeon.
True.
Everything's possible for IMGs, or maybe you even want to go to a general practice. That's all fair go, but you need to prove yourself that you are actually trained well enough to transit into any of those specialties.
That's great. I think with I actually to our audience, I would also like to show them your website as well, and if they want to get in touch with you, we'll be definitely sharing the details. So this is actually the website if you want to access and have more details about this. So the website address is emergencyfocus.net, and over there, if you go and you access, you will. They also have a Facebook page, and they will tell you all the CBD courses and AMC courses available. And definitely, I think this one the website looks pretty awesome to me as well. And this one actually,
Thank you.
this one actually is very active on social media as well. I've seen all his videos. In fact, that was the reason how we connected. And even if you want to watch through his series, I believe he has created a YouTube series on how to help IMGs and what are part one and part two, what's required in the AMC part one and two as well. Is that correct, Rizwan?
That's true. And Umar, it is day and age of the social media. The
True.
information is readily available because of the spread of the social media. And I feel that coming from a Pakistani background, the information and the vitality of an information which is readily available to you is just key. So by creating all these social media platforms, YouTube, Facebook, and other platforms, it's just create that ready connection. And I just get countless messages on Messenger and Facebook and WhatsApp and emails. Um, and I'm just trying to keep myself occupied and answer them from time to time. But that's the way forward. Compared to when I started out, Umair, trust me, these things were never available. You had a query, you had to send 18 different emails, you had to go and meet someone.
True.
This morning I had a Facebook Messenger message from some specialist in Qatar
Wow.
about Australia, and then again the next message was from someone in the UK, and they were specialists thinking of coming to Australia. And it's just amazing how the world's just completely converged and focused now, and you can get your ready answers almost immediately. So that's great, and I love to be a part of that. This is my passion, and I think this is how where I'd like to be.
Definitely, I can see that from your expressions as well. The moment you talk about that, your face is very enlightened about this. So for sure,
Face lights up.
face lights up. And I think you should also open a side business as an immigrant consultant for doctors. I think that would be a good profession as well.
Well, I'm going to need your help if you've got someone who can actually help me with some of the immigration inquiries. Because what I would really like to do is bring skilled doctors or give skilled doctors an opportunity to come to Australia. I was listening to this radio program this morning that the doctors who are working in the UK, predominantly the doctors who are working in Australia, are from the UK. They're burnt out. The system is under pressure. The National Health Service system in the NHS is under immense pressure. And they're struggling to work there and they want to migrate to other countries. And I'm thinking of that. Look, coming to Australia at that point about 17, 18 years ago, for me, at
Yeah.
that point, I just never thought about it. And I just moved. But looking back to it, I just think it was one of the best decisions. And why can't we think of newer markets directly from Pakistan? Why does it always have to be US, UK? Why can it not be Australia, South Africa, or some other countries? Because you want skill, you want a well-resourced health system. There are plenty of opportunities for all of that. So I think this is high time we think out of the box and start thinking about other options, which are in fact the better options compared to these two big countries. There was recently a lot of concerns about ECFMG recognition for Pakistan medical graduates, that USMLE might not be possible. Although I don't think that it's going to happen, because American health is quite reliant on Pakistani health system, and Pakistani doctors in American health system are quite well organized and quite high up. So
True.
they're going to try absolutely best to make sure that the college accreditation for medical colleges in Pakistan gets through. But then again, it's time to have a multimodal approach, have an approach where you are ready. I remember, Umair, that during when I graduated from Dow Medical College in Pakistan in 2001, some of my friends did USMLE, which is a licensing exam for US. They did PLAB as well, and some of them actually even took Irish exam
Wow.
for Ireland. So they were like, they're the one who are, and plus on top of that, Umair, they even did local FCPS Part 1 exam. And
Mm.
looking back at them, they're the one who stood out the best because they had so many options. If they were not able to find a job in the US because of visa, they could not get into the US, they went to the UK, completed their training, and then came back to Pakistan. So I think having had a broad exposure and this multimodal approach is an absolute vital, especially in these circumstances.
Definitely, definitely, and I'll agree to that as well. All right, so basically now we are closer to close our session. So before we end, I just wanted to ask you, do you have anything for our audience which can actually motivate them, people who are planning to come to Australia or people who are here struggling with the industry? How can we motivate them to, go further with this?
Umair, that's a question which is very close to my heart. And if I was to have a
Yeah.
conversation with a 25-year-old me, I don't know how long would that be. I won't give you my age that easy.
I
But a
think you look
conversation,
25 to me right now. I'm not sure that's the camera effect, but I think that's what you look like.
yeah, that's all the filters and everything. So conversation to 25-year-old me. Look, the good foundation is an absolute key. So let's just start there with the very basics. When you're working as a medical student back home in Pakistan, so I do go Pakistan every year, and I do engage with a lot of medical students, and I do free sessions going to Dow Medical College, Sindh Medical College, Aga Khan, and also Karachi Medical and Dental College. Given the fact that I'm from Karachi, I've mainly been to Karachi institutes.
Okay.
One of the main things that they must consider is to have a good medical qualifications, meaning MBBS from a recognized medical university. Plus, during that part, no longer is it enough to have just simple MBBS and licensing examination and boom, you will be accepted into Australia, whatever it is. You need
Okay.
to have something extra, by which I means that maybe a research experience, maybe a good clinical exposure. In fact, that is the key, even more important than research experience. If you are working as a doctor, then applying for a job in Australia, having at least 6 to 12 months of clinical experience in Pakistan is gold. So you've completed. So once medical student complete their medical education, MBBS that is, they do internship. And after internship, most of the doctors start thinking of moving overseas. But
Hmm.
I think if you're still trying to go overseas, don't waste your time on just licensing examination. I'm just doing examination. I've come across many CVs preparing from USMLE, preparing for PLAB, preparing for AMC. This is this is this is not a skill. Preparing for an exam is not a skill.
True.
Studying for exam is not a skill. You need to be actively involved in clinical work.
Hmm.
So when you're actually sitting these exams, please maintain your work. Work in fields which are good: emergency medicine, pediatrics, general medicine, ICU, general surgery, any field that you get. There's a lot of emphasis now on mental health issues. So having some experience in mental health term, even that's is so good and important. So the point that I'm trying to make is having at least 12 to 24 months of solid medical clinical experience after your house job is absolutely vital. And it's going to help you in whichever country you want to migrate. And when you are doing the clinical experience, complement that with some research or some other philanthropic work or some other skill, which will look good on your CV. Now, I've seen lots of the doctors who have been operating their businesses, they're tutoring other medical students, or they're
True.
running a skills workshop. And that's just brilliant because these are the skills which teaches them administration, communication, organization. So when you're applying for a job in Australia, you can actually put these skills on your CV. And that's what makes your CV stand out from the rest of the crowd. You're not competing with Australian medical graduates. You're actually competing amongst each other. So a Pakistani graduate might be competing with another Pakistani graduate or Indian graduate or Bangladeshi or whatever country they're coming from. IMGs compete with IMGs. And what is going to make you stand out is your clinical experience, your extracurricular activities, which I've just said, courses and skills and workshops, organizing or participating, and research experience. And if you've done that, then you're set out. And also, the other thing is that try be engaged as many opportunities. Not everything is online on Facebook or through other platforms. Try engage yourself. Now, one of the things which I often see is that people attend the courses for the sake of certificates. Umair, I don't know if that has been your observation as well. So when we do courses, the people, there'll be like 50 people registered for a course, only 4 will have their cameras on. And all of the rest of the people would have their cameras off and they wouldn't be interacting because they're only interested in certificates. That is not the way. I can certainly say the people who are engaged, who are interacting, who are trying to learn by interaction are the ones who will get the job first. So being interactive and exposing and having a broad exposure to a range of different learning platforms is also the third tier up in this level of getting a job or getting into a training program. And that's what I'd like to say, that look, it's no longer about passive learning, it's active, interactive learning, which will take you through to your next and desired level of job or country where you want to work for.
No, that sounds like a very great advice, and I'll agree to that because basically I think that's the case with every industry. You need to be a bit more passionate, more involved within the industry before you even start looking at what are the options available. So thank you so much, Rizwan, for actually coming today and sharing such beautiful knowledge with our audience. And I hope there will be a lot of people who will benefit from our discussion today. And if everyone has any questions in relation to, if you're not sure still after going through our session, please get in touch with Rizwan. I've already shared his website with you, and he's also very active on Facebook. And definitely get in touch with him, get involved, talk to him, see how you can work together, and then you can take it from there. So thank you so much, Rizwan, for coming in.
Thank you, Omer. I think that's lovely to always come across people like you who are trying to help people out in the community from our Pakistani background, or for like anybody could access this conversation and benefit from it. So thank you for providing this medium and spreading out the word. It's absolute pleasure to be talking to you. Thank you.
Thank you.